pericardium, it consists of two layers, okay, fibrous pericardium and serous pericardium. Fibrous pericardium is lying outside. This white colored one layer covering the heart, this is the fibrous pericardium. Okay, and inside it lies this serous pericardium. Silence, everyone. So serous pericardium has again two layers, parietal layer and visceral layer. Parietal layer is it is lining the inner surface of the fibrous pericardium, and this visceral pericardium, it is lining the wall of the heart. See here, this is schematic diagram of the layers of the pericardium. You practice a diagram like this, schematic diagram. So this is heart, wall of the heart. You can see here outermost covering the green colored one, that is fibrous pericardium. Okay, it has single layer, and this blue one is representing the serous pericardium. It is two layers. So the layer covering the heart tube, this is visceral layer of the serous pericardium, which is forming the epicardium. And this one, which is lining the inner aspect of the fibrous pericardium, that is known as parietal layer of the serous pericardium. And in between these two layers, in between this visceral and parietal layer of the serous pericardium, there is a cavity. You can see this cavity. This cavity is known as pericardial cavity. Okay, it contains pericardial fluid. Very little amount fluid is present in normal person. Okay, in disease condition, the amount of fluid increases, and then we will say it as the pericardial effusion. Okay, we will discuss those. So first introduction, pericardium is a conical fibroserous sac, and it encloses the heart and the roots of the great vessels. See, this is ascending aorta. So you can see here the root of the ascending aorta is also enclosed within the pericardium. Okay. So it lies within the middle mediastinum. Heart is lying in middle mediastinum. You have known the classification of mediastinum. Mediastinum class is over. Okay. So heart along with the pericardium is lying within the middle mediastinum. It lies behind the body of the sternum against 2nd to 6th costal cartilages. Okay, so these are the location. So what are the functions of the pericardium? This is very frequently asked in your viva. It gives protection to the heart, helps in shock absorption, and it protects the heart from external injury. Okay, it helps in restriction of excessive movement of the heart. It prevention of overexpansion of the heart, prevents thinking of the great blood vessels. Great blood vessels means this ascending aorta, pulmonary trunk, the pulmonary veins like this. Okay, superior and inferior vena cava, these are included within great vessels. Minimizes friction between heart and the surrounding structures, and it acts as a mechanical barrier for spread of infection. First the infection spread to the pericardium, then it reaches the heart. So if you control at the level of pericardium, heart will not be affected. Okay. These are the subdivisions of pericardium. Pericardium is conical fibroserous sac. It is divided into two layers, fibrous pericardium and serous pericardium. Fibrous pericardium is cone-shaped, single-layered thin. Serous pericardium is double-layered. It has again two layers, parietal and visceral. Parietal layer lines the inner surface of fibrous pericardium, and visceral layer is known as epicardium, lines outer surface of heart and major blood vessels. Okay, so next we will discuss this in details. So fibrous pericardium is outer layer of the pericardium. It is single layer thick cone shaped sac, encloses the heart and fuses with the root of the major vessels. You have seen in previous picture. Next, serous pericardium, inner double layer blind sac of pericardium. It has two layers, parietal layer and visceral layer, also known as epicardium. Parietal layer lines the inner surface of fibrous pericardium and visceral layer lines the outer surface of heart and the great blood vessels. Now, how the pericardium is developing? Development of the pericardium. Development of heart is covered? Yes or no? No. Okay, so heart develops from a heart tube. Okay, and these tubes have two ends, arterial end and venous end, and the heart tube folds on itself to form the heart. So heart tube undergoes folding and project into the posterior wall of the pericardial sac. That's how the divisions of pericardiums are formed. Arterial and venous ends of the heart tube are connected by a fold of pericardium called the dorsal mesocardium, and later the dorsal mesocardium degenerates and a gap called the transverse sinuses develops. Fibrous pericardium and parietal layer of the serous pericardium develop from somatofluoric layer of pericardial sac, and the visceral layer of serous pericardium develops from splenopleural layer of the pericardial sac. This development is important, these layers, because nerve supply is also different, okay, for this splenopleural layer and somatofluoric layer. So this layer is pain sensitive because it is supplied by somatofluoric layer and it is formed from splenopleural layer. It is supplied by autonomic nerves and it is pain insensitive. Okay. See here, this is a section through the heart wall. Outer, the green covering is the fibrous pericardium. This layer is surrounding the inner aspect of fibrous pericardium. So this is parietal layer of visceral pericardium. Then there is pericardial cavity. Then here is the visceral layer of the serous pericardium, or also known as epicardium. Within the, just beneath the epicardium, here you can see some fatty connective tissue, and these are the sections of blood vessels. Coronary vessels supplying the heart wall, and this is the wall of the heart. This is it consists of again three layers. Wall of the heart, epicardium, myocardium. Myocardium is the thickest, and innermost is the endocardium, supplying the cavity of the heart. Okay, in the cavity you can see rough area. These are the trabeculae. So fibrous pericardium, it is cone shaped. The green colored one is the fibrous pericardium. It is cone shaped, thick sac of fibrous connective tissue. And these are the features of fibrous pericardium. It is conical and it has an apex and a base. Apex is directed above here, where it is enclosing the great vessels. This is apex, and base is lying below, which is fused with the diaphragm. Okay. So apex is directed above and blends with the external ports of ascending aorta and pulmonary trunk, and the base is broad and fuses with the central tendon of the diaphragm. Now features of fibrous pericardium. This is the relations of the fibrous pericardium. Anteriorly, it is connected with the sternum by the superior and inferior sternopericardial ligaments. Okay, these are content of anterior mediastinum. You have read. And posteriorly, it is related to the principal bronchi. That means right and left bronchi for two lungs, esophagus and descending thoracic aorta. These are parts of the posterior mediastinum. Okay, so these are related posterior to the fibrous pericardium. Next, on each side, it is related to mediastinal pleura, phrenic nerves and pericardial pericardiophrenic vessels. Okay, these structures you will see in your dissection of mediastinum. And it protects and keeps the heart in place, prevents over distension of the heart and kinking of the great vessels. These are the functions of the fibrous pericardium. Okay. So these are the relations has been shown. Superior relation apex blends with walls of the great vessels. Inferiorly it is related to the mediastinal pleura, phrenic nerves, pericardiophrenic vessels. Anteriorly to sternopericardial ligaments. These are mainly located on two sides laterally. And posteriorly lies the principal bronchi, esophagus and descending thoracic aorta. So these are the relations of the fibrous pericardium, which is a single layer tough fibrous sac. Okay. Next we go to the serous pericardium. It is a thin double layered serous sac that lies within fibrous pericardium, lined by simple squamous epithelium and also called mesothelium. Layers of serous pericardium consist of two layers you have seen in previous picture. Parietal layer, it is outer layer, lines the inner surface of fibrous pericardium. Visceral layer, also known as epicardium, this is inner layer, covers the external surface of the heart and root of the great vessels. Okay. Visceral layer is continuous with the parietal layer along the roots of the great blood vessels. See here the development has been shown. See the red tube, this is the heart tube. Okay. Above there is arterial end, there is the venous end. So this heart tube is folding on itself so that the arterial and venous end comes closer to each other. Okay. Arterial end later on forms the ascending aorta and this venous end is forming the pulmonary trunk. These two are lying together in the viscera of heart, you will see that. Okay. So you can see this heart tube is folding on itself and it is projecting into the pericardium. Okay, that's how the visceral and parietal layers are forming. See this, all the chambers are developing, two atrium and two ventricles. This folding of the heart tube occurring and projecting into the pericardial cavity from the posterior aspect. You can see it is projecting from the posterior aspect. So what is pericardial cavity? It is a potential space between the parietal and visceral layers of the serous pericardium. Normally it contains a very small amount of serous fluid, that is about 15 to 20 ml pericardial fluid. Pericardial fluid reduces the friction between the two layers. See here the green layer it is representing the fibrous pericardium and you can see the roots of the great vessels. This is ascending aorta. This is pulmonary trunk, superior vena cava, inferior vena cava. These are the four pulmonary veins. Two right pulmonary veins, two left pulmonary veins. You can see the roots of the great vessels are enclosed within the pericardium. So what are the contents of the pericardium? This is frequently asked in your viva of heart, thoracic viscera. Okay, content of the pericardium also can come as a short note or part of theory question. Content of pericardium is heart, ascending aorta, pulmonary trunk, lower half of superior vena cava, terminal part of inferior vena cava, terminal part of pulmonary vein. Here you can see all this. So these are the content: heart, ascending aorta, pulmonary trunk, terminal part of superior vena cava. This is terminal part of inferior vena cava and four pulmonary veins. These are the contents of the pericardium. Now we will go to the sinuses, sinuses. These pericardial sinuses are important for your theory. Both of them can come as a theory question, transverse sinus and oblique sinus. Okay. See here, this is the location of the oblique sinus. It is enclosed above by the J-shaped attachment of the serous pericardium. And here is the transverse sinus lying between the arterial end and venous end. Arterial end formed by this ascending aorta and pulmonary trunk, and venous end is formed by these four pulmonary veins, superior and inferior vena cava. So this is location of the oblique sinus, and here is the transverse sinus. Okay. Next we go to the blood supply and nerve supply. Fibrous and parietal layer of the visceral pericardium. It is supplied by arterial supply by branches of the internal thoracic artery, musculophrenic and descending thoracic aorta. And venous drainage is by azygous and internal thoracic vein. Azygous vein is lying posteriorly and internal thoracic veins are lying anteriorly. Okay. Okay, here also for the arteries descending thoracic aorta is lying posteriorly, and this internal thoracic and musculophrenic arteries are lying in the anterior chest wall. Okay. And visceral pericardium, it is arterial supply is by coronary arteries, right and left coronary arteries, and venous drainage is by coronary sinus. Okay. Next we go to the nerve supply. As the fibrous and parietal pericardium, this nerve supply is important for your clinical aspect. It comes as I explained why. Why it is pain sensitive, why it is pain insensitive like this. Okay. So as the fibrous and parietal pericardium develop from somatopleuric mesoderm, they are supplied by phrenic nerve. Phrenic nerve is a somatic nerve, that's why they are pain sensitive. And as the visceral pericardium develops from splanchnopluric mesoderm, it is supplied by branches of sympathetic trunk. That is, it is supplied by autonomic nerve supply. Sympathetic trunk is sympathetic supply, vagus nerve is the parasympathetic supply, autonomic nerves, and that's why it is insensitive to pain. Okay. So visceral layer is insensitive, parietal and fibrous pericardium is pain sensitive. So this schematic diagram you practice for the two sinuses. This is the location of transverse sinus. Here is the location of the oblique sinus. Okay. So sinuses of pericardium, it can come as a short note, or individual sinus can also come as a short note. Transverse sinus or oblique sinus. So sinuses are communicating zones that are developed by the reflection of the serous pericardium. Two sinuses of pericardium are present, transverse sinus and oblique sinus. Here is the transverse sinus, this is oblique sinus. Okay, why the sinuses are formed? Okay, the visceral pericardium forms two tubes around the great vessels of the heart. One is arterial tube around embryonic arterial end of the heart. That later forms the ascending aorta and pulmonary trunk. See here, this blue colored one, it is around the arterial end, around the ascending aorta and pulmonary trunk. Another is venous tube. See this lining, this blue colored lining is around the venous tube. Okay. So another around the venous tube, around the embryonic venous end of the heart, and that later forms the superior inferior vena cava and four pulmonary veins. Initially, arterial and venous ends are connected by dorsal mesocardium. Here these two layers are connected by dorsal mesocardium, and this dorsal mesocardium is reabsorbed to form this transverse sinus. See here, this is a transverse section through the heart at the level of the atrium. See here, this is the right atrium, this is left atrium, separated by interarterial septum. This is the arterial end, ascending aorta and pulmonary trunk. So the transverse sinus is lying posterior to this ascending aorta and pulmonary trunk, and anterior to the vein. See, these are the veins. Right pulmonary vein, left pulmonary has been shown in this section. Okay, so this dotted line is showing the location of transverse sinus. And projection from this atrium, this small ear-like projection, these are the auricle. Okay. So transverse sinus, it is a horizontal passage between the anterior arterial end and posterior venous end of the heart. It develops on degeneration of the dorsal mesocardium. What are the boundaries? Anterior boundary is formed by ascending aorta and pulmonary trunk. Posterior boundary by superior vena cava. Here is the superior vena cava. Inferiorly bounded by the left atrium, and superiorly lies the bifurcation of the pulmonary trunk. On each side opens into the main pericardial cavity. On each side it is open. Okay, you can see. So here the finger has been put through the transverse sinus. Okay, you have to show in the viscera also. In the cadaver you have to show the transverse sinus like this. You have to place the finger just behind the ascending aorta and pulmonary trunk like this. Okay, that's how you show the transverse sinus. In the heart viscera also you will be asked to show the transverse sinus, and also in the cadaver you can be asked to show this transverse sinus. Next, we go to the oblique sinus. See, this line is showing the oblique sinus. Okay, so to show the oblique sinus, you have to place your hand posterior to the heart. Okay, just beneath the pericardium. So it is a cul-de-sac behind the left atrium. It is recess of serous pericardium enclosed by a J-shaped sheath of visceral pericardium, and that encloses 6 veins, superior and inferior vena cava and 4 pulmonary veins. Development: oblique sinus develops due to absorption of the pulmonary vein in the developing left atrium. Absorption of the pulmonary vein, that's why it is for formation of 4 pulmonary veins occur. Okay, they were together, joining with together, and then they were draining into the left atrium, but gradually the proximal end get reabsorbed into the wall of the left atrium. That's how the 4 veins are opening separately. Okay. So what are the boundaries of the oblique sinus? Anterior boundary is by left atrium. Posterior boundary by parietal pericardium. On the right side, 2 right pulmonary veins here. This is the right side, this is left side. On the right side, 2 right pulmonary veins and the inferior vena cava. And on the left side, 2 left pulmonary veins. Superiorly, there is reflection of visceral pericardium along the right and left superior pulmonary veins. Here is the superior boundary formed by reflection of visceral pericardium between the 2 superior pulmonary veins along the upper margin of left atrium, and inferiorly it communicates with the main pericardial cavity. Here it is communicating with main pericardial cavity. For transverse sinus, you can see on the both sides it is communicating with the pericardial cavity. But for oblique sinus, on the one side it is closed by reflection of the visceral pericardium, and on the other side it is connecting with the pericardial cavity. Okay, understood? So this is summarization of sinuses of pericardium. These are communicating zones developed by reflection of serous pericardium. 2 sinuses are there, transverse sinus and oblique sinus. Transverse sinus is horizontal passage, lies between the arterial and venous end of the heart. Relations: anteriorly lies the ascending aorta and pulmonary trunk, posteriorly superior vena cava, inferiorly there is left atrium, superiorly bifurcation of the pulmonary trunk. On each side, main pericardial cavity is lying. Oblique sinus is cul-de-sac behind the left atrium. It is J-shaped. Relations anteriorly there is left atrium, posteriorly parietal pericardium, superiorly reflection of pericardium, inferiorly main pericardial cavity. On the right side, two right pulmonary veins and IVC. On left side, two left pulmonary veins. This is the clinical aspect of transverse sinus. Transverse sinus serves as a passage for ligature around aorta and pulmonary trunk in cardiac surgeries, okay, to prevent blood loss. These are ligated through the transverse sinus, the aorta and pulmonary trunk, ligated through passage of the ligature through this transverse sinus, okay. Next clinical aspect is pericarditis. Pericarditis is inflammation of the pericardium. There will be sharp retrosternal pain and that increases on inspiration and does not increase on expiration. Pericardial friction rub you can hear on auscultation with stethoscope, and this pericardial friction rub it sound like a sound as rustle of silk. Okay. So here you can see there is friction occurring between the two layers, parietal and visceral layers, and there will be friction rub in pericarditis. Okay, so these are the clinical aspects. What is the significance of transverse pericardial sinus? During cardiac surgery, temporary ligature may be passed. Silence everyone. What are you talking? You. Stand up. তোকেই বলছে। Yes. What are you talking? Don't talk in class. If you don't want to do the class, you just go out of the class. Okay, sit down. So during cardiac surgery, temporary ligature may be passed through transverse sinus to block the blood flow through the aorta and pulmonary trunk. Pericarditis is inflammation of the pericardium and pericardial friction rub. In pericarditis, smooth opposing surfaces of the serous pericardium become rough and it results in pericardial friction rub and can be heard as the rustle of silk with the use of stethoscope. Okay. Next we go to the pericardial effusion. So, fluid accumulates within the pericardial cavity, okay, and the heart in chest radiograph. In PA view of chest radiograph, the heart will look like, heart shadow will look like a water bottle appearance of heart in chest radiograph, and cardiothoracic ratio will increase, okay. The transverse diameter of the heart is more than half of the total thoracic diameter. That is cardiothoracic ratio will increase in pericardial effusion. You can see here there is fluid accumulation within the pericardial cavity. Okay. So pericardial effusion, what is pericardial effusion? It is accumulation of excessive fluid in the pericardial cavity is known as pericardial effusion. What are the causes? Congestive heart failure. This is important short note, pericardial effusion. An X-ray of pericardial effusion also important in your final year also you see the X-rays. Okay, pericardial water bottle shaped heart. Also important for your MCQs. What are the causes? Congestive heart failure, pericarditis, tuberculosis, kidney failure, heart surgery and so on. These are the main causes of pericardial effusion. So due to effusion, there will be pressure on heart and prevention of complete filling of the chamber of the heart. And water bottle heart you will see on chest radiograph, that is in X, it is X-ray sign, water bottle heart. Here you can see. What is cardiac tamponade? This is also asked in your Viva, important term. In pericardial effusion, the accumulated fluid will give pressure on the heart valve, okay, because the fibrous pericardium is non-expandable, okay. So heart can only expand within the pericardial cavity, okay. It is naturally serous fluid, but if there is infection, mucous material or any other kind of fluid can also accumulate here. Okay. Or in hemopericardium, there will be blood accumulation. Pyopericardium, there will be pus accumulation like this. It will change according to the collection of fluid. Material of the fluid, name of the disease will change. Okay. Okay, so cardiac tamponade, here is compression of the heart due to inelastic nature of tough fibrous pericardium. There will be compression over the heart due to accumulation of fluid within the pericardial cavity, and it reduces filling of the cardiac chambers during diastole and thus reduces the cardiac output. That is the effect of cardiac tamponade. You can see here, these are the fluid is giving pressure over the heart and prevent expansion of the heart during the diastole. So cardiac tamponade, compression of heart chamber indicated by these arrows, and inadequate filling of heart chambers will lead to reduced cardiac output and there will be reduced blood pressure in cardiac tamponade. Okay, understood? Next is Pentalogy of Cantrell, also known as thoracoabdominal syndrome. All these five things will be present. It is a rare congenital anomaly that has this following defects. One is omphalocele. Omphalocele is protruding abdominal viscera through the umbilicus. There will be anterior diaphragmatic hernia. There will be sternal defect, ectopia cordis due to absence of pericardium. Ectopia cordis means pericardium is absent and heart is directly exposed to outside. Anterior chest wall is also absent. Okay, this child does not survive, generally dies within 1 month of birth, and there will be also heart malformation. Okay, so these five defects are together present in Pentalogy of Cantrell. Okay, this is important for your MCQ questions. Next is pericardiocentesis. Pericardiocentesis is done in excessive accumulation of fluid in the pericardial cavity. Aspiration of fluid from the pericardium is known as pericardiocentesis. Position of the patient. Patient is lying supine with head end of the bed is raised by 30 to 60 degree to bring the heart closer to the anterior chest wall. And it can be done using two approaches, subgyphoid approach and parasternal route. Subgyphoid approach, the needle is inserted in the left costogyphoid angle here. This is gyphoid process of sternum. Here is the costal margin. So in between the costal margin and gyphoid, this is costogyphoid angle. In the left costogyphoid angle, you have to place the needle of the syringe. The needle is inserted in the left costogyphoid angle with an upward inclination of about 45 degree to the skin. And another is parasternal route. A needle is introduced into left fifth or sixth intercostal space here. Fifth or sixth intercostal space at the left sternal border. Under ultrasound guidance it is done and it is preferred elective procedure. Okay. So two routes are important, subgyphoid approach and parasternal approach. Okay. So pericardiocentesis is also important for your clinical aspect, can come as a short note. Okay, so clinical aspects of the pericardium is very important. Those ligation through the transverse sinus, this is important, explain why question. Then which pericardium is pain insensitive? This is also comes as explained why. This pericardiocentesis, pericardial effusion, all those clinical aspects are important. Okay. And two sinuses you prepare as a short note. Transverse sinus and oblique sinus, very important for your theory. Okay. And pericardium can individually come as a short note. We have to write down different layers, arterial supply, nerve supply like this. Okay. And its divisions, fibrous, serous again divided into two, parietal and visceral layers like this. Okay. And practice a schematic diagram of the pericardium. And for sinuses also you practice schematic diagram. I have shown you previously. Okay, any queries regarding today's topic? And for your viva table in thoracic viscera, you will be asked to show those two sinuses, transverse and oblique sinuses. Okay, and can be asked theory questions also in viva table. You can be asked anything.